I am Dr. Sridhar Kalyanasundaram. I am a consultant neonatologist and director of NICU at American Hospital, Dubai. I'll be discussing some of the common problems related to the preterm in terms of neurologic outcome. So the common challenges facing the preterm newborns can be classified as those in the acute period when they are in the neonatal unit, as well as when they are following up as discharged babies from the postnatal wards. Premature babies, as the name itself indicates, are babies who are born much before their due dates. The more premature the baby, the higher the risk of problems. The common neurologic problems include intraventricular hemorrhage, periventricular decommalacia, which is basically breakdown of the white matter around their brain. These are problems in the acute period. Depending on the severity of the illness, the severity of the bleed, the outcome tends to vary. The premature babies, because they are developing in an environment which is different from the safe, dark and quiet environment in the womb, they have a higher risk of developmental problems even if the normal scans in the newborn period. The follow-up problems relate to the varied development as well as the damage to the developing brain as manifest by the abnormal scans. We can have cerebral palsy, which is a movement-related disorder. The babies may have spasticity in the limbs, delayed development. They may also have learning difficulties related to the same problem. They may have hearing or visual-related problems. Vision-related problems are both due to the brain injury as well as a specific problem related to premature babies called retinopathy of prematurity. Coming on to the question of common challenges which get in the way of early diagnosis and how we can rectify them. Obviously, all the intensive care units who take care of sick newborns in the United Arab Emirates are equipped with cranial ultrasound facilities, but not all of them have MRI facilities for newborn babies. As I will be discussing in my lecture, the current evidence supports the use of MRI at discharge for preterm babies in prognosticating their neurodevelopment. So this is one of the challenges that we may need to overcome, make MRI available or readily accessible to more of these post-preterm babies, which may help in monitoring them. The other important challenge we have is lack of expertise in follow-up and management of these babies, especially in relation to the multidisciplinary input. Once a preterm baby is discharged home, we have something called early intervention therapy, which is meant to stimulate and channel their development and also reduce the chances of their having developmental sequel. We need physiotherapy, occupational therapy, speech and language therapy, and this multidisciplinary input is from personnel who have expertise with preterm babies as well. And this is in addition to the follow-up with the support of neonatologist and possibly a neurologist. So it is challenging, and it would be helpful if the neonatal intensive care units in the whole of UAE, at least in each zone, develop a network of services which will help both the private and the public sector in terms of the babies getting their appropriate care. I will be speaking at the Arab Pediatric Medical Congress in late February. I had the experience of participating in this conference last year as well. It was a very well organized and well attended event, and it's my pleasure to be participating in it again this year. The program is suitable for both pediatricians and neonatologists with separate streams for the pediatric and neonatal interested personnel. The topics are quite varied and interesting, and the speakers are all of good caliber and expertise. I would definitely recommend colleagues to attend this meeting if they can. So in the conference in February in the Arab Pediatric Congress, I will be speaking on the correlation of neonatal imaging with the neurodevelopmental outcome. So the neonatal imaging in premature babies includes cranial ultrasound, which is done during their initial period of stay in an ICU. Most units have a guideline supporting the use of cranial ultrasound in the first 3 to 4 days of life, followed by repeat scans at the end of the first week and as needed clinically, and also at 36 weeks and pre-discharge. Currently, there is more and more evidence coming up supporting the use of magnetic resonance imaging in the preterm babies, at term gestation as well as at follow-up. There is a good correlation between the abnormalities on magnetic resonance imaging, some of which may not be picked up on the cranial ultrasound, and correlate with the neurodevelopmental outcome of these premature babies. So for example, white matter densities may be seen on the MRI, which are not normally picked up on the cranial ultrasound. The major cranial ultrasound findings that correlate with neurodevelopmental outcome include intraventricular hemorrhage of grade 3 and 4, periventricular leukomalacia, which is of the cystic type, as well as periventricular hemorrhagic infarction, also called as grade 4 intraventricular hemorrhage. We have ventriculomegaly or evolving post-hemorrhagic hydrocephalus also as a correlate of neurodevelopmental outcome. These factors, if they are present on the newborn ultrasound, increase the risk of neurodevelopmental problems by as much as 60 to 70% in the babies when they are followed up. The MRI, however, is more sensitive, and so it can pick up changes which are more subtle than these major changes. These are definitely picked up on the MRI as well. So the MRI adds on to the benefit of cranial ultrasound. As the prognostication is very important for the parents, any additional information we may be able to provide is useful. And it also encourages us to focus on early intervention therapy for those babies who have been shown to have higher risk. So it is a very important topic which all of us should be familiar with, and I would support the use of MRI in the newborn period from this point of view.